I had asked, he's been so patient to wait, Dr. Christopher Baldwin, Superintendent of Macon County Schools, who, speaking of stress, I will say this before Dr. Baldwin starts. We've had a couple of meetings, the liaison committee and Dr. Baldwin. Just like everybody else that stood at that podium in the last hour, Chris, we sympathize with you and your board too. I mean, it's so what I've asked Chris to come forward tonight and talk about, number one, what the governor had to say this afternoon, and he's not.
Opportunity. I know that there are a lot of people that want to know what school year 2021 is going to look like, so I'm more than happy to come and share what I do know. Before I start though, just what you said, I know that there are a lot of challenges that we're all going to be facing. We've already faced this spring and will continue to face for the foreseeable future. But one of the things that I'm grateful for is that in Macon County, working with all the departments, Sheriff's Department, Warren's Department, Kathy's Department, they're all good people. And known Adam my whole life, and many of his other deputies and SROs for the past 30 years, and they're all good quality people, as all the others departments are. We serve 35,000 other very good people. And together we'll face a lot of challenges over the next several months, but we'll come through it. Just to give you an idea what the school system's been facing, just go back to March 13th. March 13th, the CDC released the new guidelines for schools, and they said that they did not recommend school closures. 14 days did nothing to mitigate the spread of COVID-19. The closure of 2 months had minor mitigation effects of COVID-19. So I felt relieved by what CDC released on March the 13th. Had a superintendent's meeting where the school board attorneys met with us and shared what it would look like in the event of a school closure, and more or less told us that at some point a school closure was coming, which was in direct contradiction of what the CDC had just released. Came home that afternoon, the governor made an announcement at 4 o'clock and basically said that he was going to go with the CDC's recommendation. No preemptive school closures were recommended. And then Friday night, that March 13th, my phone started ringing. Principals had questions about possible exposures at 3 different schools. How would we handle that Monday? I was on the phone with the then director, Carmen Rocco, how to handle that, school nurses, how to handle that situation. And on March the 14th, the governor had another announcement, and that was that schools were closed for 2 weeks. In a matter of 24 hours, we were all over the place in terms of how we want to handle COVID-19. And I can tell you that it hasn't changed much since March the 13th. Every time I open my email, something new is going on. We learned at the end of the school year, after a lot of trial and error with regard to remote learning, some things that we did well, some things that we need to improve in the event that we go to remote learning in 2021. We also learned at the end of the school year that we had to prepare for 4 possibilities with regard to school year 2021. A plan A, which was minimal social distancing, a plan B, which was moderate social distancing, and plan C, which was complete remote learning. But there was also a 4th plan, and that was for us to provide the option for remote learning for any parent who might be uncomfortable sending their children back to school. So that's 4 plans that we have to prepare for, and really we know that at some point we're going to be in plan A, we're going to be in plan B, we're going to be in plan C, and we're going to offer those remote learning opportunities. Today, we found out that the governor's recommendation is that every school system begin the school year in plan B. School systems have the option to go start the school year in plan C, but not in plan A. The plan B that the governor released today has some subtle differences from the plan B that we were planning for. Particularly, the wording in the plan that was released does not include 50% capacity. It specifies that we will have only enough students in a building that we can maintain 6 feet of separation. That's a subtle difference. I don't think it's going to have a huge impact on our Plan B, but we do need to go back and look and make sure that we can't actually allow more students in our buildings. So we've got to go with the principals to make sure that we don't need to modify our current Plan B before we take it to the board Monday night. Another subtle difference is that we're planning to provide masks or require masks for all employees and any child above age 11. The governor's Plan B specifies that all students K-12 will be required to wear masks. Some of the things that we've got to prepare for in either Plan A or Plan B is temperature checks for all students and staff before they enter our facilities or our transportation. That means we have to take a temperature of every single child and adult before they get on the bus or come in our building. Even at half capacity, that means we'll have to check the temperature of 500 students at Macon High School, 300 students at Macon Middle School and Mountain View Intermediate. We've purchased 400, or in the process of purchasing, I think around 400 handheld thermometers, but we've also purchased 20 or more kiosks that will measure the temperature of any child that passes through the kiosk at a rate of about 70 students per minute. If we don't have those devices, it'll take us hours to screen every child coming through that building. In addition to screening the children for temperature, we also have to have a symptom screening. We have to ask them a series of questions regarding if they visited any hot spots, if they have any new symptoms or anything like that. Parents can provide an attestation form that addresses many of those things, but we still have to screen every child for symptoms when they get on our campuses. It's going to be a huge.
We want to make sure that everybody understands what you just said, especially when it comes to the transportation.
Yes.
We've had this discussion, the school liaison committees have had this discussion, and go into a little bit more depth to that with this board and explain when you say, it's easy to miss if you start checking the temperature of every kid getting on the bus and logging that temperature. Number one, where's that person going to come from? These questions that we brought up. So talk about that a little bit more about the transportation issues and the challenges, especially in a rural community like Macon.
In order for us to screen the temperature of every child that gets on the bus, that's going to require another adult besides the bus driver. The bus driver, for instance, has to have their temperature checked. That's going to, in order for us to do it fairly and accurately, we need another adult to screen the bus driver before they actually get on the bus. So we'll have to have a bus assistant that will not only screen every child that gets on the bus for the temperature, but also help maintain that social distancing once they get on the bus. Now, in order to provide that, if we can get our teacher assistants, if we get 50 teacher assistants or teachers who be willing to get on a bus in the morning, if we pay them $25 to ride a bus, we're looking at $175,000 if this lasts for 100 days. It lasts for 180 days, the entire school year, we're looking at $240,000 just for that bus monitor. No other PPEs and things like that. We're also, in addition to those thermometers and kiosks, we anticipate needing 7 gallons of hand sanitizer per day. That's at a rate of 2 ounces per student per day. We purchased sneeze guards so that our elementary students can be better separated as they're going through their lessons in the classroom. Now, those are just a few of the things that we're facing for the children who are coming back to school. In addition, we're providing signs all over the building that will show them 6 feet of separation, the direction that they should travel in the hall. That's a recommendation that we have one-way halls. That's hard to do in most of our buildings, but we can control the direction that the children are flowing in the hall. Most of our elementary schools are already doing that, so it shouldn't be that much of a problem. So in addition to all the PPEs, we still have to prepare for at least part of the time during the B schedule, or Plan B, we'll be providing remote instruction. Now, one of the issues that we saw this spring was connectivity. That has a significant negative impact on our ability to deliver instruction. It varied from class to class as to the number of students who were able to connect well enough with the teacher so that they could take part in a live stream lesson or a video or a class chat or something like that. So, many different classes in Macon County offer different levels of connectivity with their students based on how well the students connect with the class. Some of the things that we're doing to address that, we have purchased a number of jetpacks, wireless devices that if the family, the household, or the community building, church, fire department can receive cellular signal, that site can act as a wireless hotspot. We're hoping that in some of these locations, such as the churches and the community buildings, that small groups of parents may be able to gather, and one parent can supervise a group of children, allowing the other parents to go back to work on the days that they have to take part in remote learning, or if they choose to go completely remote. So we have many different challenges. Going back to what you all were discussing about screening and the requirements that you'll be faced with in the event someone tests positive. For the school system, if a student or a staff member is exposed to a person who has tested positive for COVID-19, any staff member or student who is exposed has to stay out of school 14 days. Any student or staff member who tests positive for COVID-19 has to sit out for 10 days. Now, here's the thing, this is the issue I'm about to mention. It's going to cause us some real problems and challenges pretty early on in the semester, and I really don't know how to anticipate how big of an issue this is going to be for us. Any student or staff member who experiences a new symptom, at least one symptom, a fever, chills, shortness of breath, difficulty breathing, a new cough, or a new loss of taste or smell, that student or staff member with a new symptom has to sit out for 10 days or until they get negative test results, or until they haven't had any symptoms for 3 days, including a fever, without any fever reducing medication. That may be one of the most significant challenges that we face, because we don't have enough substitutes as it is, and if every staff member follows that guideline, we're going to be stretched to provide instruction, and that's either remotely or in person. If a teacher contracts COVID, they won't be able to provide instruction remotely, and I don't know how we're going to provide a substitute in that situation at this point. So we have a lot of challenges. We have a lot to work through. We will be sending out another survey to families and staff. We were planning on sending that out at the end of July, because we sent out a survey around the 1st of June that gave us some information that we could begin planning on Plan A, Plan B, Plan C, and for that remote learning. And that survey told us that 85% of our families wanted live instruction. They wanted to come back to school. 15% wanted to continue on with remote learning. 85% of our staff wanted to return for live instruction. 15% would have preferred to stay in remote learning or had underlying conditions that required them to stay in remote learning. Now, obviously, since we did that survey, a lot has changed with regard to COVID-19, both in North Carolina and Macon County, and it's become a political issue that's going to play into a lot of how people react to that over the next few months. It's hard for us to predict how that's going to play out in the school system. But we will send out another survey. Depending on the number of parents that choose to do remote learning now, is going to play a huge role in how we meet the requirements of Plan B with regard to social distance within our buildings. So that may affect how our Plan B is actually implemented even after we get it approved Monday night, if it's approved.
Chris, I don't know, speaking on behalf of the board, and they certainly speak for themselves, that we've had this discussion, and we don't envy your position either. It's, I just, what can this board do to help you? And I don't know what we
Well,
can do.
I would say that the first thing is going back to what Kathy asked with those nurses. If we have to screen every child that comes in the building, and if a child shows any of those symptoms during the school day or staff member, then we have to isolate that student or staff member in a room in the school building. And I don't know what staff that we have that can provide that screening and also provide the isolation for either the staff member or the student until the parent can come pick the child up or the staff member can get consultation.
Any questions for Superintendent Butler?
How much CARES money did the education system get?
Macon County to this point has received $1,087,000.
So that's what's funding all this
Yes.
initial.
Yeah, now I would say that I do need to point out that if this board hadn't had foresight of funding technology over the past 2 or 3 years to the level that you have, remote learning would not be an option for us right now. And I don't know what we would do in Plan B without the technology that we currently have in the school system. So thank you for that.
So you're comfortable, I mean, you got the funds to do
Well,
what you need to do.
I wouldn't say comfortable. Well, here's where we are with that. What we've been told at this point, and I don't know what this next stimulus package is going to look like. I don't know how much K-12 money is going to be in that. We've been told that we have until December the 31st of 2021 to spend this money. So in other words, that's got to do us this school year and next school year. We've already used about half of it, and the school year hasn't even started. Purchasing all those PPE materials, and what we foresee that we'll need in terms of personnel with regard to those bus monitors. And also, one of the things that CARES Act money does allow for is for us to contract with mental health professionals. So we are budgeting about $150,000 of that to contract with some mental health professionals that will cover some of the schools that aren't currently covered. But so we've already used about half that money, and the school year hasn't even started. Do I feel comfortable with that? I'd like to say yes, but it's
We don't know.
no.
Chris, let me ask you this, you're dealing also with 3 distinct school systems.
Yes, and that's another thing I need to say. Nantahala Plan B, the Franklin Area School Plan B, and Highlands Plan B is going to look somewhat different, and they look a lot different. We're still working on the details of all those plans. We know that there's going to be roughly half the students every day in our building, though. We do know that much.
Chris? A couple of questions. And I'm not trying to get too much into the day-to-day details of how you're going to make this work. I'm glad it's your job, not mine. But let's just assume that as a baseline, let's use the 7% that Kathy was showing on the slide. that we got 7% infection rate. And we apply the 7% to the teacher population only. So day school opens and you test, given today's data, you got a 7% chance, 7% of your teachers are going to test positive that morning. I don't think you keep teachers in lockers and just give them out when you need them. What are you going to do? And I'm just picking on East Franklin because it's close to us, but let's just say that third grade teacher at East Franklin tests positive, and you got 7% of that classroom that tested positive that day. So you stuck them somewhere in an imaginary room, and then you got somebody that you currently don't have today that you can't just put in there. You got to have somebody with them. So that's a position, a body. And then what do you do about that classroom? The 93% of students that are good to go, you lost a teacher, there's not a teacher's assistant. How are you going to handle?
Well, we're going to go as far as we can with substitute teachers, and then I assume at some point we'll have to go remote learning.
So if that, I guess, I apologize for getting too involved in the mechanics of it, but I mean, if you call, if that happens at 7:45, the teacher, I mean, a substitute, you got to find a substitute, and then they got to make their, I mean, it's.
Well, unfortunately, those type scenarios happen all the time in a school building, where we'll find out at 7 o'clock in the morning, or actually, it's usually about 5:30, 6 o'clock, we'll find out that a teacher's sick and can't come to school. And we'll have to make arrangements. Now, a lot of times it would be that, we'd find a sub. I don't think we'll have that opportunity this year. I think we'll run out of subs pretty quick. Most of our subs are over 65, or a lot of our subs are over 65. I don't know how many of them are willing to work at this point. So at 6 o'clock in the morning, if we find out that the teacher can get there, we'll try to cover that class. It may be that a teacher has their planning or a teacher assistant. Someone will have to cover that class until we can get through school day, and then we'll have to try to make arrangements for the following day. And it may be at that point that class, that particular individual class, has to continue on with remote learning, depending on how sick that teacher is. If they've only tested positive, they may be well enough so that they can continue on with remote learning. But they can't be in the classroom with those kids, and a lot of those kids may be quarantined depending on exposure.
And the details that were revealed today will allow you the flexibility to do that, to allow.
To do what I just described?
To move the schedule around.
Yeah, it depends on if that teacher, if we learn that teacher has tested positive or was exposed on that particular morning at 6 o'clock, then obviously that teacher cannot come to school for 10 days. If they've been if they've been exposed, they can't come 14 days. If they test positive, they can't come for 10 days. At that point, if we learn that a teacher's tested positive or been exposed, at that point we'll talk to the health director about how to handle the class with regard to the particular students that they've been in close contact with, which is going to be all of them. And we'll have to make a decision at that point as to whether or not every member of that particular class has to stay home for 10 days, and how we'll handle that.
And that gets back to your issue with non-compete, which ends up coming back to this
School board.
round desk.
I think that, and the school board's got a, Coach Goldsmith, you got a full agenda too.
Oh, yeah, that's why I'm stepping to this for the governor today.
We can't forecast any hypothetical situations.
We're all rookies.
Well, I tell you what, we've forecasted about as much as we can forecast. The thing about it is,
Fans and stuff.
the thing about it is, I am not an epidemiologist. The example I've used is that, in January and February, on a good day, I'm a sorry weatherman. I can't tell if that road's gonna be slick or not, but I can call the sheriff I can call DOT. I can call Warren, see what roads are slick and things like to make a decision about it. But we don't, I can do that with this.
Nobody knows.
Nobody
understands it, so.
Any more questions for Dr. Baldwin?
Did I send you an email?
About that tower.
Yeah, the
Yes.
23rd.
Well, I've been answering a lot of emails there. I did get, I meant to reply to it.
We were at a planning board meeting the other night. We used the word crisis. Now, you just got a definition to it.
No doubt.
And that's what we want to share, that we need more connectivity within our broadband, things like that. We need to open up Macon County a little bit to small town or something like that, to try to reach the kids, because what you were saying there, it's going to happen this year.
Yes.
It's just way.
We hope at some point we have all the kids back in the building, but we know we're going to be in Plan B, and we know that a percentage of kids are going to be in remote learning the whole year.
When you talk about, if a teacher gets sniff situation, they have to go home. Who releases them back to work? Is that
All right. I don't want to get this wrong.
the doctor, have to go to the doctor, or?
If confirmed positive, if they have one symptom, fever, chills, shortness of breath, difficulty breathing, new cough, new loss of taste or smell, if confirmed positive, COVID-19 or person has not been tested 10 days since the first symptoms, no fewer than 3 days without the use of fever-reducing medication, and 3 days of symptom improvement, including coughing and shortness of breath. If they get a negative COVID-19 test and have no fever for 24 hours without the use of a fever-reducing medication, and they have felt well for 24 hours, I guess they can go to school there. If confirmed diagnosis other than COVID-19, stomach virus, ear infection, then they can just follow the normal protocols for attending school.
On the 80 hours, this emergency medical leave, is that already discussed?
Not for 2021. That's something that we are unclear on right now. That's not something that Human Resources has a clear direction on for school year 2021. We know we were able to do it this spring, but we don't know how long that's going to last in 2021. Do you, Derek, for 2021?
Is that December 31st too?
Yeah.
Is it up until December
Yeah,
31st
it's
now?
open
Yeah.
until December 31st.
I've not heard that from,
That was what was in the initial legislation.
was it?
Yeah.
Okay.
I just hadn't heard that before.
Okay.
Well, Chris, I guess the 17th is a month away.
Yeah, and, I'll tell you what, we're looking forward to seeing some kids back in the buildings. I don't know how long we'll get to keep them, but we're looking forward to having them back.
Well, keep the board informed, this board, Chris. Same to you, Coach Smith.
Thank y'all.
Your board's got it sorted too. Thank you, Dr. Baldwin.